study from a wonderful company, Informatica. This is about lessons from large-scale AI triage from a digital, not quite sure if I should say front door, in Australia. If you'd like to join me on stage, please give us a round of applause.
Thank you very much.
Thank you so much. My name is Piotr Orzechowski. I'm the CEO and founder of Informatica. It's a great privilege to be here today, and thank you so much to the panelists for an amazing session. Today, I'll be talking about our lessons learned from deploying, yes, probably one of the largest scale AI-powered digital front doors in Australia. I guess this is my clicker. So very quickly, the challenge is pretty much similar everywhere we go, accessing healthcare. Australia might seem far away, but the problems they face are similar to what we have in Poland, where I'm from, probably England and NHS. First of all, growing pressure on services, GP surgeries, emergency rooms are packed. In the meantime, patients want to self-manage their symptoms, but they're looking for a reliable tool 24/7. And this is where patient triage kicks in. But in order for it to work, it must be clinically validated. It must provide actionable and accurate advice. So now let me introduce the real hero of today's story, which is Health Direct Australia. So this is a government-funded digital front door, I can say it this way, and the goal is simple. Whenever patients are unsure what to do, whenever they have children sick, you can either enter your symptoms online. There will be an AI triage algorithm that will take you through a questionnaire and will advise what to do next. But you can also call. There is a large-scale nurse advice line, so nurses also rely on AI-powered clinical decision support tool, and they will guide you to the right place at the right time. Let me share one quote from Dr. Nirvana Lakraj, who is the Chief Medical Officer of Health Direct Australia, who led this implementation. They were seeking a clinical decision support system that could take into account multiple symptoms. They wanted it to reflect the real consultation with a doctor and taking into account risk factors, chronic history, medications, travel history. And unfortunately, the system, the AI triage system, the legacy system they had at the time simply was not good enough. And this is why they decided to bet on AI. And here are the results. So why was the old legacy system not good enough? So it was based on decision trees. Decision trees, you can think about it as a set of protocols, a set of guidelines, of course reliable, curated by medical doctors, but unfortunately missing some very important features of today's AI systems. And where Informatica kicked in is providing a Bayesian probabilistic inference engine that can take into account multiple symptoms, that can guide patients through a dynamic consultation. And some of the outcomes I'd like to now share as lessons learned. I hope you can read this small font at the bottom. This is from the New England Journal of Medicine AI paper called Right Care, Right Place, First Time. So all the results I'm going to share are peer-reviewed. And what was the impact of switching from the decision tree to the inference engine? So first of all, self-assessment completion rates increased by 71%. So huge change from 49 to 84%. 50% of consumers who initially wanted to go to the emergency room were diverted to lower acuity setting. And what Lucy mentioned, 46% reduction in over-triage compared to legacy system. This is super important because unfortunately rule-based system or decision trees, in the way they're built, in the way they're managed, they cannot offer the proper accuracy and result in heavy over-triage. Just to give you a sense of a scale, Health Direct is available to over 26 million of people in Australia. Just this year alone, there will be 3.8 interactions through both the nurse advice line and the symptom checker. And here are, again, a sample of outcomes we managed to achieve. So we analyzed 1.5 million such triage encounters. I need to speed up a little bit. So first of all, there was almost a full virtual elimination of patient uncertainty, dropped by 99.6% in amount of people surveyed who were unsure what to do next. There was 200 increase in non-urgent care intentions, so people deciding to switch to self-care or GP practice instead of going to emergency rooms or urgent care centers. And lastly, 1/3, so 33% decrease in intention to visit an emergency room. So impact is possible at large national scale, but obviously it's not as easy as one may think. What was critical was local adaptation. Even though we've spent over 150,000 hours of doctors' work to build our system, we still needed to tailor triage levels, tailor the prevalence of conditions, add new conditions such as snake bites that are, I guess, endemic to Australia. And that required really tight collaboration between Informatica's team and clinical leadership of our partner. Change management, absolutely critical as well. Imagine this, nurses on a nurse advice line, they were used to the old system, the way it worked, the way it behaved. So confronted with a completely new paradigm of AI inference engine, they didn't like it at first. But that required a couple of months of involvement from their leadership, training, finding champions. And now the new system is rated higher in terms of satisfaction among nurses than the legacy system. And last but not least, building to improve at scale. What we have with Health Direct is that we collect data every day. And based on that data, based on what we call a feedback loop, our accuracy can only improve over time. And that's a feature that unfortunately no non-AI system can match today. So summing up very quickly, a couple of lessons in how I hope what we do translates to the vision of NHS. National scale AI triage is possible and it can have impact. High completion rate and adherence are also possible if the tool is engaging and personalized enough. Yes, it's possible to change emergency room recommendations at scale. And I hope this echoes well with NHS England's priorities, moving analog to digital, hospitals to communities, and focusing on patient navigation. So that's it from me. Thank you so much for listening. If you'd like to check your symptoms, you can use our Showcase app, and I'll be around, of course, to talk more. Thank you.
Thank you so much. Very relevant presentation.